So what we're starting to see right now is a number of states slowly opening up into what they call phase one or phase two reopenings. And that basically is governors setting out a set of criteria that states have to meet in order to safely reopen retail stores or restaurants or places where people congregate. Only a very few states have allowed gatherings of people, groups of people over 5 or 10. But in reality, the long-term getting back to what we think of as normal or what will be our new normal is going to take a lot of months. There's a big concern at the moment that the number of states that are moving towards reopening might be moving too fast. And if they are, they're likely to see new spikes in viral outbreaks that they might not be able to contain, and they might be forced to go back into lockdown again. One of the concerns that we're hearing from economists is that the public health lockdowns in the short term may do a lot of economic damage, but they may be only a fraction of the economic damage we see if lockdowns have to come back into effect and if we have to stop the economy once again.
What's remarkable, and I think fits with what we understand, is that Americans, whether you're Republican or Democrat, young or old, male or female, basically have personally adopted social distancing as something that's an important part of living in the context of COVID. And so I think that, first of all, is pretty remarkable. It means that an entire nation, pretty much across the board, has basically made a huge behavior shift. And I think at some basic level, it's because people have a really strong intuition that there is a challenge, there is a virus that's spreading across the country, and that there is something they can specifically do about it in order to reduce the risk. And I think that actually is one of the deep lessons, is that where I think people are really responsive to, and it's shown up in data in past pandemics, is when they have specific guidance about what they can do. When you start getting really high level and get into very general arguments, you start getting into very kind of polarizing, slogan-driven perspectives. Let me give you an example. There's a debate about kind of reopen versus lockdown. And both sides are kind of lampooning the other. They're kind of making, they're basically saying, it's either all economy or all health. We either go forward on one foot or the other. And folks, especially in public health and economics, all basically agree that health and economics feed each other in both directions. You need a job to have good health, you need good health to have a job, and we need to be able to both move forward with our lives and be safe. I think Sweden's brought up a lot to say, look, they're kind of just letting it ride, through the country. But that's really just not true. When you hear, the Minister of Health in Sweden, and you look specifically at what they're doing and what their guidance is to a population that really generally follows and trusts government guidance, a lot of the things that other countries are recommending, they're actually doing. But they're finding their own way to do it. And if you look at the data, Sweden right now has higher caseloads than other Nordic countries, but it has lower caseloads than, Spain or Italy. And so, I think you start to see that we're all trying to find our way through a gray zone of risk.
These sort of economic lockdowns and enforced social distancing are a tactic that public health officials can use, but they're not a long-term strategy. People get antsy, they want to get out of their houses. That's a totally human reaction to being cooped up for so long. I know certainly I feel that way. But the fact is, what this lockdown does is it's not intended to entirely squelch the coronavirus. It's meant to give us all time to make the preparations necessary to handle any viral outbreak that might happen. We still think that it's likely that 60 or 70% of Americans are going to eventually get the coronavirus. The only way to completely eradicate it is with a completely effective vaccine. And of course, we don't have that. So what these lockdowns have done is they've bought us some time. Now, have we used that time adequately to make the preparations we need to be ready for the next round of viral outbreaks? Do we have significant social distancing protections and plastic dividers between dinner tables or things like that? I mean, have we taken the necessary steps to make it safe for Americans to return to work and to return the economy back into full force? I don't think we have yet. We've got quite a ways to go. States are only now starting to build their contact tracing teams, and that's a key element in all this. The goal is to squelch the virus to a point at which we can contain little tiny outbreaks. Now, so what happens then is the armies of contact tracers in states around the country will be able to find an outbreak quickly and sort of encircle it, if you will, as fast as possible, so that a small outbreak among a few people or maybe even a dozen people doesn't become a massive conflagration that turns into a regional or even national outbreak.